Hi everyone, this lecture is on lymphocytosis. The main causes of lymphocytosis are excitement, chronic inflammation, hypoadrenocorticism, and neoplasia. Young animals typically have higher lymphocyte concentrations relative to adult animals. Therefore, this is not a true lymphocytosis, but a pseudolymphocytosis when adult reference intervals are used for young animals. Similar to physiologic neutrophilia and physiologic lymphocytosis, epinephrine causes an increased blood flow. This increased blood flow physically washes the marginal lymphocytes into the circulating pool. And since the circulating lymphocytes are the ones that are sampled during a blood draw, the lymphocyte concentration on a CBC is increased. Lymphocytosis in chronic inflammation is due to antigenic stimulation, which causes lymphoid hyperplasia in lymphoid tissues, and those lymphocytes then circulate in blood and non-lymphoid tissues as well. Hypoadrenocorticism is a condition in which the adrenal cortex fails to produce hormones, typically cortisol and aldosterone. In this disease, cortisol deficiency is thought to cause a lack of baseline lymphocyte sequestration and lymphocyte lysis. Therefore, more lymphocytes circulate through the tissues and the lymphatics in the blood and do not enter lymphoid tissues, and less lymphocytes undergo cell death. Additional changes seen with hypoadrenocorticism will be further explained in the eosinophilia lecture. Lymphoid neoplasms are also known as lymphoproliferative disorders. They are broadly divided into those neoplasms that originate from the bone marrow, also termed leukemia, and those neoplasms that originate outside of the bone marrow. Acute lymphoblastic leukemia, chronic lymphocytic leukemia, and lymphoma are all proliferations of lymphoid cells or lymphocytes, and multiple myeloma and plasmacytoma are proliferations of plasma cells. Acute lymphoblastic leukemia is a proliferation of large lymphoblasts that originate from the bone marrow. Affected animals often present with a sudden onset of severe illness, and this is because the neoplastic cells efface the bone marrow early in disease. So this crowds out the normal hematopoietic cells and causes decreased production of normal hematopoietic cells. This process of crowding out the bone marrow is called myelophthisis. As a result, patients often have severe neutropenia that leads to secondary infections and marked thrombocytopenia that causes bleeding. The presence of anemia is more variable, and that's because the red blood cells have a relatively long circulating lifespan. The number of neoplastic lymphoblasts in the blood is variable, but it's often greater than 20,000 cells per microliter. The lymphoblasts themselves tend to be large cells, meaning that they're larger than the size of a neutrophil, and they also have prominent nucleoli. Chronic lymphocytic leukemia is a proliferation of small lymphocytes that originate from the bone marrow. The lymphocytes are smaller than a neutrophil, contain dense dark staining nuclei, and are frequently at concentrations greater than 50,000 cells per microliter. Animals with CLL often have a chronic history of mild and progressive clinical signs, and sometimes CLL is diagnosed on routine examination without the patient showing any clinical signs of disease. CLL replaces the bone marrow very late in disease, so animals tend not to have cytopenias at initial presentation. Lymphoma is a neoplastic proliferation of lymphocytes that originates in any tissue outside of the bone marrow. Most often, there is lymph node involvement, and animals present with generalized lymphadenomegaly. There are many subclassifications of lymphoma, and depending on the subclassification, the patient may either have acute or chronic onset of disease. Lymphoma typically causes decreased concentrations of blood lymphocytes, but occasionally it can have hematogenous involvement and cause a lymphocytosis. This is known as stage 5 lymphoma. In this case, there would be lymphoblasts in peripheral blood, like the ones I previously described. However, like CLL, lymphoma causes myelophysis late in disease, so decreased production of hematopoietic cells are not expected at initial presentation.